I'm Dr. Rizwan Chaudhry. I'm a board-certified general and bariatric surgeon, fellowship trained in bariatric surgery at the Weight Loss and Metabolic Program at CHI St. Luke's Patients Medical Center. There's been multiple studies showing, comparing obese people versus non-obese patients or non-obese people. And long-term, it comes down to one thing: mortality. People die sooner because of obesity. And it's due to these cardiovascular risk factors: diabetes, high risk for stroke, high risk for heart attacks. So, it's not just that you're gonna be more sluggish and slow and you're gonna have more knee pain, but it puts a risk to your life. So multiple studies are out there that show the mortality benefit. 50% decrease in mortality in VA men, men who are in the VA institutes. And these are sicker gentlemen, and they follow them along for multiple years, over a decade, and have shown that there's been a 50% decrease in mortality for those who underwent the surgery versus those who didn't and weren't able to lose the weight on their own. I think the main thing I've noticed at Patients Medical Center is attention to detail. From the pre-op nursing staff to the operating room staff to the post-op care provided by the nurses. It's very involved. They know how to take care of the patients. The anesthesia staff is very engaging with me before I even do the operation, so they're very patient-oriented. It's called Patients Medical Center for a reason, and I've experienced that firsthand, seeing my patients raving about their experience at the hospital. So, yes, they have the equipment, they have the staff, but it's also very patient-oriented. I see patients 6 months, a year after surgery, and they're totally different. From their outlook on life, how happy they are, they're off their depression medications. It's not just healing the diabetes, taking the weight off, but it's about starting a new life, honestly. I had a patient recently who she would not even look at my face before or even after 3 months after surgery. She's about 6 months out, she looks at me, she talks to me, she engages. She's got a totally different personality. So those are things that they're really not in the books. I experience that as a physician, and I see them because I engage pretty intimately with my patients. I get to know them, and their personalities differ. They're more outgoing, they're more social. I think that's a component of the surgery that people don't realize.